Hello, everybody. Welcome to another podcast with the super gynecologist, Dr. Usha Kiran. So, she is a consultant gynec in a couple of practicing places in the UAE. We'll hear all about that. And today's episode is actually purely focused on issues that younger women and teenagers go through. So, if you have children amongst these ages, or if you are in this line, I urge you to stick through till the end. We're going to be busting some very common myths and talking about all that is necessary for personal growth mentally and physically. Great. Welcome to the show, Dr. Usha. How are you?
Hi, Dikshha. Thank you.
Great. So let's first talk about where. What do? You do a lot of things in even gynecology. Okay. Yeah. So yeah, what all things are you into?
Right, I'm a consultant gynecologist, as you mentioned, and with that, I am actually a laparoscopic surgeon, a minimal access surgeon, in fact. So I do a lot of gynecological surgeries. I practice in various hospitals like Prime Hospital, which is my main base, and also in Emirates Specialty Hospital and Clemenceau as well on a regular basis. I do hold clinics there, and I do surgeries as well.
Wonderful. How interesting. Okay, so let's get straight into the conversation. I want to know, what are the common misconceptions about women's health that you come across, and what are the main issues that these days people are talking about, and they say this is not important, that's not important, we can ignore this. Some of those things.
See, misconceptions, I think, are a part and parcel of everybody's life. Doesn't have to be anything to do with gynecology as such, because even I have certain misconceptions. Basically, they stem from areas which you are not knowledgeable about and you don't have enough information about. So in gynecology, some of the common ones that I have come across is that women saying, "Oh, I don't have any problems at the moment. I mean, I'm perfectly fine. I'm having my regular periods, and why do I need to see a gynecologist?" Overall prevention in regarding health and checkups is not something which is a part of most of the cultures.
Correct.
Exactly. If it's a Western culture, they're a little more proactive in prevention, but the rest of the cultures are mostly like, if you have a problem, you go to the doctor.
Correct.
So that is not just for gynecology, even for general physical health. But that part is slightly reduced now. Majority of the people want to get checked with their diabetes and blood pressure, various things, but they don't want to really go to a gynecologist if they don't have a problem. One of the reasons probably is that gynecological examination in itself is not a pleasant one, so people kind of try to put it off. But the other thing is that, oh, I am not married, I'm not sexually active, I'm not pregnant, so why should I go to a gynecologist? And the third is, I'm still a young girl, or especially the parents, oh, she's not even an adult. Why does she need a gynecologist? In these cases, I would like to say that for the younger girls who are not active, or the adolescent girls, you going to a gynecologist doesn't necessarily mean you will have a checkup.
Correct.
Okay.
Correct.
It is also for knowledge, for counseling. So if you look at it as, if you go to a gynecologist, you probably will get a lot of information.
Sure.
Which can help you prevent various things, and which can help you look after your gynecological health. I think that should be the concept among parents and younger generation.
Correct.
Okay. And one of the things, I know we're talking more about younger girls here, but one of the commonest misconceptions in the older age group that I've seen is irregular bleeding. Irregularity of the periods or the bleeding around menopausal age group is perfectly fine.
Okay.
I think I'm going for a menopause, so it's okay if I'm having heavy bleeding or if I'm having irregular bleeding. I would like to say that's the most signaling symptom that there might be something wrong. Maybe most of the times there might not be anything wrong, but it's always worth visiting a gynecologist to make sure that nothing is wrong. Then you can call it probably menopause.
Correct. But better get it checked in time. Okay. See, whenever I go visit a doctor, any doctor, and I think all of us in Dubai, this is quite common that they check our BP, they check our height, weight, and max sometimes they'll check our sugar.
Yeah.
They'll not check anything else. So what kind of screenings or tests do you recommend people should undergo on a regular basis to ensure that they are medically fit?
See, overall, you're checking your, for a general point of view, overall checking your blood sugars, checking your cholesterol, lipid profile, basically we call it, checking your liver function test, checking your kidney function test, probably trying to get your blood pressure done, getting your ECG done. People think that, oh, I'm not old, why should I get an ECG? Or I'm not fat, why should I get a cholesterol? I'm a young, fit, person, why should I get my blood sugar and cholesterol checked? But that's not the question. The question is, we're talking about these checkups to look for something which is not symptomatic so that we can address it in the beginning of it or even before it happens. So those are the general things that I would suggest, having overall an organ system check. We have a heart and a lung and kidneys and liver, which is functioning in the body. And I think it's a good point to get it checked. I get it checked myself. Obviously, I did not start it very young.
Sure.
Because even though being a doctor, you would be surprised how many doctors don't have regular checkups.
I'm quite certain, because you know what's even coming up? There are so many doctors who are getting heart attacks very early on in life.
Yeah.
And it surprises me, how come you're a doctor and you didn't take care of your health?
Yeah, I agree. Many doctors don't go for regular checkups.
Yes.
And many fit people don't go for regular checkups. I keep telling this to my kids. They're all young kids and 21-year-old having sort of good muscle mass.
Yes.
And they say, Mama, you're not fit, I'm fit.
Correct.
I said, you check your blood results and mine and the rest of the parameters.
Yeah.
You'll find that at my age, I'm much fitter than you.
Yeah, quite certain.
So the physical fitness, the outward appearance, or the age, or being in a certain profession does not make you immune to problems. So we all need to have these checks. Coming to the gynecological checkups, there are sort of mainly just 3 checkups. It's very easy actually getting a gynecological checkup. One is your pap smear, which is the cervical cancer screening that we do to pick up the precancerous cells. Now, this doesn't have to be done in everybody, because cervical cancer comes only when you're sexually active. So if you're not sexually active, never been sexually active, I'm not talking about you're temporarily not active. I'm talking about you're a virgin. You've never ever have had sex. You don't need a pap smear ever. Okay. So the nuns who are not active don't need a pap smear. So till the age that you become sexually active, you don't need a pap smear. Once you're active, after 2 years is when you start doing your pap smears. Should be done every 3 yearly till you're 65. Okay. Now, the rest of the examinations, like a pelvic ultrasound and a breast ultrasound, vary according to the ages.
Okay.
Right. Now, if you're a young girl in adolescent period, ideally speaking, yes, you don't really require a pelvic scan. We don't really require a breast scan unless you have any symptoms. But my advice is, I don't want to go by the textbook that you don't really require. Having a baseline, we live in a world where we want to be proactive about our own health. So I suggest to everybody, have a baseline breast ultrasound, have a baseline pelvic ultrasound. It will at least give you an idea of everything is hunky-dory there. And then if you're young, you don't really need to do it every yearly. Maybe a couple of years down the line, just do another one. So intermittently just keep doing. But once you become active, once you're getting pregnant, you're into the reproductive age group, make this more often. A yearly ultrasound of the breast and a yearly ultrasound of the pelvis is probably a decent kind of a thing to go for. Because, sorry, you wanted to say something?
No. I wanted to elaborate on this only. I'll just ask you, Subhra, what kind of preemptive symptoms are you talking about, whether it comes to breast scanning and pelvic scanning? Ultrasound.
We are talking about screening, so we're not talking about any symptoms.
Okay, so just
I want
basic.
people to do this even without any symptoms. That is something that people don't do. They're waiting for the symptoms. So what I said was, from the adolescent onwards, once you start developing your breast and you have a period, ideally you should have one basic ultrasound. Maybe after that, do it 5 years down the line. It's fine. But have one, so that sometimes in the younger girls, it is not to do with... we're not talking about cancer and things. It's to do with some congenital anomalies.
Yes.
Uterus is probably not well developed. We have different shapes and sizes of uterus. Uterus which is divided into 2. All those things can be picked up very early. Okay, so that's what I'm looking at. So have one as a baseline. Anytime you have a period, you've turned into a woman, have one baseline. Maybe 5, everything is fine. 5 years down the line, have another one. But once you are into the reproductive age group, a yearly ultrasound of the pelvis and the breast is probably a good thing to go for. Because nowadays, we do find breast cancers very early.
Indeed.
And they can be very easily picked up in the early stages. If it's picked up in the early stages, it's
can
curable.
be cured faster.
Cured
Or
faster.
at least done.
Yeah.
Very
So
nice.
when you get towards the 40 plus and menopausal, you really, really seriously need to have this every yearly. I mean, that's when you have no excuse not having them.
Correct.
And after 50, a yearly mammogram is a must.
Very nice. Very nice.
So it depends on the age, but you need to have them, but the frequency varies with the age groups.
Sure. No, completely understand. Absolutely. And how often do you recommend women should visit a gynecologist? Say once in 6 months, once in a year at least. How often is a basic recommendation?
I would suggest if you're totally asymptomatic, once a year is more than enough.
Okay.
But if you have any symptoms, and also sometimes what happens is patients do have certain symptoms which they are putting it down to, oh, this is fine, I'm having a little bit of bloating for the last 6 months, and that's fine. But if you ended up going to a gynecologist and saying, I'm having a bit of bloating, she's not going to put it down to it's okay, normal. She probably will kind of investigate and find out. And especially ovarian cancers have such vague symptoms. Majority of the women come to us, and when you start questioning, they tell us, I've had this for almost more than a year or 6 months. And then by that time, they've come up with more symptoms. It's already widespread. So I think visiting 6 months, probably people will think it is a little premature. Yearly ones, I think, is a good point to take.
I'm quite certain that you would also be coming across some very different cases, because now I think the era that we are living in, teenage pregnancies are becoming common.
Yeah.
And perhaps even like juvenile intercourse is also becoming common. So, I mean, my question here is, do doctors or gynecologists judge their patients? Because I think this is a lot to do with, the whole perception that, oh my God, what will they think about me if I open up to them, tell them that I've done this? What's it like? Do they judge?
Yes, they do, unfortunately.
Okay.
We are not supposed to judge.
Yeah.
But it's not to do with the gynecologist as such. I think it's to do with your own belief systems. When your belief system clashes with another person and you're going to say, okay, fine, this is not right.
Right.
So the right and wrong is not a universal right and wrong. The right and wrong is decided in your mind based on your belief system.
Totally.
So gynecologists are human. Just because they're doctors, they're not above all these belief systems. So they do have, and I do have some of my own personal colleagues who do they're very judgmental. But honestly speaking, I don't judge my patients. I don't judge my children. So patients are like my children. So I don't judge them. Reason being, I'm here and they're coming to me for something because they think that I can help them. Now, if I really have to help them, they need to tell me the truth.
Yes.
If they need to tell the truth, they need to trust me not to judge them. The moment I start judging, we all want to look good in front of other people, whether it is a doctor or a neighbor or a friend. So we don't want to say things which brings us down in front of their eyes. So the moment I start judging, I'm not going to get the whole truth. If I don't get the whole truth, I'm not going to treat them. So common areas like you were mentioning where doctors judge patients is... One is premarital sex.
Yes.
Okay.
Yes.
Now, whether it is right or wrong is completely based on the era that we are living in and the culture or the society we are living in.
Yes.
That itself says there is no such thing as universal truth.
Correct.
Okay,
Correct.
It can vary from place to place.
Sure.
So if somebody is sexually active in the adolescent period, obviously it's the body's need. The moment the hormones start kicking in, the attraction happens and things can, given the opportunity, can lead to
something
intercourse.
else. Yes.
Now, my duty as a doctor, somebody comes to me and says, I've been having sex at this, whether you're 18 or 16.
Sure.
My age is to make the person or the young generation aware, what comes with that.
Right.
Okay, the good and the
Totally.
bad of it.
Yes.
And also to some extent to make them understand it is natural to feel attracted to the opposite
Right.
sex and wanting to do it. But wanting to do it, where does that take you?
Correct.
Okay.
I
Now, the
agree.
two main things we need to make aware of is the STDs and the pregnancy.
Yes.
The consequences.
Yes.
So as long as they know the consequences and how the consequences will result eventually in their life and where they can end up, I think making them aware of it and showing them the safe sexual practices. I cannot, a girl comes to me and tells me I've been active. If I tell her,
You can't be preachy.
yeah, so I've got colleagues who will tell me, oh my God, this is very wrong. You shouldn't be
Yes,
doing this.
yes.
And you need to tell your parents about it. And I will talk to your
Correct,
parents, bring them
correct.
in. If I do that, the girl is going to walk away from here.
Correct. And
continue
perhaps not
to do.
even and perhaps not even go and visit another doctor.
Yeah. So continue to do
Yes.
what she's doing
Right.
without the opportunity where
Precautions.
she gave me that I
Yes.
could have actually told her
Yes.
how to do it
Yes.
and what not to do and what
Yes.
to do kind of a
Yes.
thing.
Yes.
So, and things like pregnancy out of wedlock, which gets judged. Now somebody gets pregnant. I don't think anybody is planning to get pregnant. Nobody wants to do that.
Sure, sure.
But
Intentionally.
sometimes
Situations
mistakes happen.
Yes,
Mistakes happen.
yes.
Sometimes failures happen. Sometimes they overlook the precautions. But if it's already happened, they've come to you because they need help. Obviously, abortion in UAE is completely illegal, so
Correct.
we don't go around handling. But I've worked in UK, I've worked in India, and where it is legal based on
Sure.
circumstances.
Sure.
So my duty there is to give her the safer option of how she wants to go with it. Whether somebody wants to continue a pregnancy, somebody wants to, and also go through the emotional journey with them, because when you get pregnant, even if I have a choice of abortion, it is not emotionally such an easy decision to make.
No, not at all.
I don't think anybody wants to intentionally kill their own child.
100%.
So being with them emotionally and giving them the safer options. Because if I look down upon her and say, oh my God, you're pregnant, out of the bedlock, and this is really totally wrong, she's going to go away. She's going
Correct.
to find illegal means to do it.
Indeed.
Which will endanger her health. And I have failed as a doctor to...
If you've not been able to save a life.
Yeah.
Correct.
To drive her towards healthier section, I've driven her towards something which was dangerous. So in fact, it is not even a responsibility. I feel it could be criminal if you start judging your patients.
Sure. I completely agree.
Yeah.
Completely agree. Because I'll tell you what.
And I do feel, sorry to interrupt you, I do feel we are the health police. We are not the moral police.
You've mentioned a very valid point. Whenever we perceive doctors, this whole thing, whether I should share, should not share, obviously comes into picture. And then I have personally seen a lot of cases wherein, because of this being too preachy, being the moral police, you push them to not go visit a doctor. And then, you have these random chemists and, these self-proclaimed doctors, hakims, etc., giving you different things. Go and have a papaya.
Yeah.
You will, have the abortion would be easier. Do something else. And then that causes further issues.
Yeah.
Okay? Oh, indeed. That's
On that note, I would like to say there was no abortion law in India before. And a lot of women were dying from septic abortion. Visiting these quacks who would say that they would do something. And once the abortion law came in as a legalized abortion law, the amount of septic abortions and mothers dying due to this reduced drastically. So in a way, making it legal
has improved the
betterment of women's health.
Very nice.
Unfortunately, I come with no judgment.
Yeah.
And many of my patients tell me, doctor, it's so surprising, nothing shocks you.
Yeah.
And I truly don't get shocked by anything. And I'm like, okay, fine, that's fine. You've done this. Let's see what
next
best can we sort out. Yeah.
Correct. I think that is really, really important. Move on, find a solution.
Yeah.
Whatever has happened, we can't go back and change
Yeah.
anyway. All right. Now, for younger women, particularly in the teenagers, okay, what kind of non-medical remedies and lifestyle changes can help them manage period pain more efficiently?
So some girls hardly have any pain. Okay.
Right.
Some of them have a moderate amount of pain. Some of them have extraordinarily severe pain. Okay. Now, pain has two parts. One is how it's generated. So your body might be geared to generate more pain. Basically at the end of the day, it's all chemical locha. So all the neurotransmitters that get transmitted can generate more pain, or it might be generating a certain amount of neurotransmitter, but you are actually perceiving it more. Okay, the nerve fibers are sending the signals. So there are two pathways to it. So when you look at lifestyle as such to see how you can attack these two parts to reduce the amount of pain that is produced in itself, yes, certain amount of foods can actually help. Because there is a enzyme called cyclooxygenase. Any food that helps to bring down that a little bit will actually generate less pain. Okay, but that is only a small portion. Like you can use your ginger, turmeric, even dark chocolate can actually help that. So those are some things, if you probably during the menstrual cycle period, if you use them, you probably will generate less pain. And then comes to the perception part of it. The perception part of it, one is acceptance that certain amount of pain is inevitable during menstrual period. So that helps you to get up instead of feeling, oh my God, now I've got a period and I've got pain. What do I do about it? Probably accepting that certain amount of pain is normal. I'm not saying that, somebody who's severe pain should say that, okay, fine, this is normal to live with. That's not possible.
Correct.
And also somebody who's having extremely severe pain. I've had girls who are going dizzy and collapsing in the schools and things like that.
Yes.
Those need to see a doctor, a gynecologist, to see if there is anything that is really causing this pain so severe. If there is nothing, then obviously some of them require medication, but we are looking at health, lifestyle changes here. Exercise is the best way because it actually releases endorphins, which are like the opioids. Which are like the pain relief that we actually give medically. So your body is capable of releasing them. But what happens is during the menstrual cycle, you're in pain and you're not feeling very good, you're feeling bloated, all the hormonal changes happening. You don't want to do any exercise.
No, in fact, we are advised not to do. Okay, I'll be honest, I'm saying this on camera. My mom tells me, don't exercise in periods and also don't pick up anything heavy. And so is that true? Are any of these things relevant?
Partly yes, partly no.
Okay.
Now, regarding exercise, don't do any exercise is wrong.
Okay.
Because exercise, in fact, as I said, will release endorphins, will help you cope with the period overall, not just the pain. Overall, the feeling of you're having this period, you're not feeling really good about the whole thing. It actually tilts that by producing more endorphins, so you start feeling a bit better and normal about, the whole period. Lifting heavy weights, yes. Probably you're not best to lift the heavy weights because your ligaments are a little more lax in that period. So by constantly lifting heavy weights, you might increase the chances of prolapse and all those kind of things. So I wouldn't go for lifting heavy weights, but aerobic exercises are good. Walking is good. Stretching is good. So most of these, like even for yoga for that matter, yoga can release hormones like serotonin, dopamine, and endorphins. So it actually makes you feel calmer and suppresses the pain perception.
Very nice.
And meditation suppresses the pain, this thing, because it diverts your mind to a different level.
Sure.
You're less aware of your body and you're more aware of your mind. And yoga partly does that as well, because you're focusing on a particular asana. There are specific asanas as well. I'm not very sure because I'm not the yoga guru, so I don't know whether exactly those asanas help or not, like Balasana and the bridge pose, Setubandhasana. Those are supposed to help because they're more concentrating on the pelvis. Whatever said and done, yoga will help you in terms of focusing your mind to a particular part of the body and then suppressing the impulses which are traveling. It is very simple. If you've seen previous days when you would have headache, like from my mother's days, they would have this Amrutanjan.
Yes.
Okay, Vicks or Amrutanjan. They used to just apply it on the head and
balm laga liya bed mein.
Balm laga liya. So as soon as you put the balm, you get a lot of irritation.
Correct.
Okay, it's like your eyes are watering, burning.
Yes.
So, and then originally I used to think, how can making all this burn make the pain go away?
Sure.
It does. Because there are superficial pain fibers and there are deep pain fibers.
Yes.
When you start stimulating the superficial pain fibers, the impulse stops going through the deeper pain fibers. So you're like diverting that to here, and then you're taking away that headache. So similar way, when you're doing yoga or exercise or whatever, your meditation, you're making that nerve impulse to go to some other place where the other parts are getting subdued. So that can help as well. So these are some of the ways that you can kind of deal. But if it's severe, you will need medication. You will need to see a gynecologist.
Okay. Is heavy bleeding normal during periods, and because I used to have friends when I was in school who used to change their pad every 4 hours.
Yeah.
And there are some that actually have overnight or okay and stuff. So what is normal in terms of a regular flow?
Okay. Now, if you look at it medically, as such a theoretical definition, they say about 80 ml of blood loss during the period is expected to be normal. Okay. But it varies. Like you said, there are some people who are having 3-day periods. Some people will have a 5-day. Some people will have a 7-day.
7 days, yes.
Some people will change every 4 hours. Some people will change every 6 hours.
Correct.
So we look at it as if the period is not giving rise to any anemia, your general health is not suffering, then that's probably okay for your body. Plus, if you're having a 3-day period and suddenly you change to a 5-day period, the variation is what is important. You are changing 2 pads a day and then you start changing 4 pads a day. That's when you say, okay, my period has now gone abnormal. I need to check it out. So it varies from people to people. So you have to look at it as at an individual level.
Is it possible to get pregnant in periods during your menstrual cycle?
Ideally speaking, no.
Okay.
Okay. But what you're having is a period or not is sometimes questionable. Because people can actually have at ovulation bleeding.
Really?
Yeah, sometimes.
Okay.
So bleeding happens basically because there is a little change in the hormonal setup, and then the lining of the uterus sheds and bleeds. So sometimes during ovulation, people can have bleeding. And if you think that that was your periods and you're having sex at that time, you've got a high chance of getting pregnant. Yes, ideally speaking, you have a regular period and you're like, it's a clockwise period and you know your period dates. So if you're having a period, it should be the safest time.
Okay.
But that comes from the knowledge of whether you know your period exactly, is coming on the right time, you're not having any spotting, you're not mistaking.
Correct.
So I wouldn't go blankly suggesting to young girls saying that if you're having bleeding, you're safe. I would say first check it out, whether it is your period or whether it's your ovulation bleeding or anything else.
Sure. Nowadays, also periods have started coming very early on. I remember I got my periods when I was 11 years old, but then I had a classmate who got it at 8. And why is this happening? And is this normal? Is this okay? Should people panic? Or what can we do for at least our growing girls that we can, manage it safely?
So the average age for having the first period, menarche, is at around 12. The range is from around 10 to 15 to 16, okay? So anything below 10 or more than 16, we should be looking at it's abnormal and we should be investigating. But as you said, nowadays, we are getting the periods earlier. One of the things could be just evolutionary change, which is happening in the species. So up till 9, being a gynecologist, I don't go around kind of jumping the gun and start investigating because, yes, you can have a little variation. But anything below 9, like 8, 7, that definitely is abnormal. So we need to be looking at it. So we are not looking at now the abnormal precocious puberty, which is only a small portion. So that though anyway requires investigation. Anything above 16 also needs investigation. We are looking at how do we prevent this, not exactly an abnormal, but a physiologically still abnormal kind of a thing, which is happening earlier. One of the main reasons is the growth of the girl's body, because when you reach a certain set BMI weight, that's when the periods come. So if a girl is extremely thin, she might actually have a very late period. Okay. So in that sense, if the girl is kind of increasing the body weight because the fat also produces estrogens, so that might actually trigger early menarche. Nowadays, as you see, most of the young girls are obese. Unfortunately,
yes.
All the McDonald's and the KFCs are doing
Shores
it.
And the bagels and the things.
So the donuts and you name them.
The pastries,
and,
the cake.
Yeah, so it's
Been
there,
done
out there. It's out there, and young people don't like home food, and they are like gorging on this, and that gives rise to obesity, and obesity in turn can actually make the periods come a bit earlier. The second thing is that the chicken and meat and whatever we are using these days also comes sometimes adulterated. Not in every country, but in some countries, it could be adulterated with the hormones especially. So they're getting an extra hormone from outside, which their body wasn't producing, which can trigger off early menarche as well. So my advice is for all the young girls, please watch your food. Parents, especially of the young girls, please make sure that your child is not getting obese at that early age.
Right.
And watch the food, make sure that they exercise, keep their weight in the normal range. If you want your child to have really a very healthy gynecological life, I would suggest look out for no hormone added meat.
Right.
Because you get them. I mean, I'm not saying that just because there is the label means that it's absolutely nil, but at least it gives you a little more protection.
Sure.
And also organic food. That
as
at
much
least
as possible.
Yeah, how much ever is possible. So those are the things that we should be looking at, because getting menarche early might look like, so what? If she gets menarche at 10 or 9, does it make so much of a difference? Yes, it does. Because early menarche is linked to future cancers of the ovary, cancers of the uterus, cardiovascular disease, heart attacks, things like that. So ideally speaking, just the early menarche is not the question. It doesn't matter when you have a period a little early, but it is the consequences of it which we should be looking at.
Correct. And doctor, my mother had a very difficult time introducing periods to me. And she was actually also, we didn't have YouTube and so on at that time as well. And she was really finding words to, talk me through it and so on. How do you recommend parents should talk to their children about periods? And what is the best way to introduce periods to younger children?
Like you said, in your time, there wasn't a lot of information on the net. In my time, there was no information. Okay. Absolutely zero information. But now we have the abundance of information. In fact, in some ways, it's good. There's a lot of information. But in some ways, it's bad because the information might not be actually very relevant and can be taken in by the teenager or adolescent in a very different way. Okay, so we have the good and bad of the thing, but it is a little easier topic to introduce. Having said that, my son told me, he is now 23, okay, about a year back or so, he said, "Mama, you're so bad being a doctor. You never ever introduced me with all the sexual whatever kind of thing. You never gave me a lesson." And I was like, I thought I gave you. I was kind of gently talking about a few things in and around it. I didn't make him sit down and tell him exactly what the act of sex is.
Yes.
But I did. And then I said, I thought I told you. He said, "Oh no, you never told me anything. That was totally useless. What information you gave me." So I'm like wondering, so I probably am the wrong person to tell the parents what information to give.
Totally.
And then he said, at least you should give my brother, he's 2 years younger to him. And this younger brother is sitting in front of me. I said, "Sharad, do you need the information? So at least I'll correct myself." And give it. He said, "No, Mom, everything is on the internet. Don't worry. I can manage on my own." Okay. But jokes apart, it doesn't have to be making the child sit down and talk about in one day, in one session. It needs to be gently introduced. And when can you introduce? The right time of introduction is because you know your child. You know when, if the child is like, let's say now the child is about 10 years and the child absolutely has no clue, no hormonal changes are happening in the body, and the child is not even mentally oriented towards anything about the sexual awareness or the period, and then you start introducing the topic, you might shock the child.
Correct.
So you need to wait for the body to do its part, and you see things are happening. The girl is starting getting interested in the boys and various things, and then you see mauka dekh ke bolna padega. Then you start gently introducing, and nowadays kids don't really like lectures.
Correct.
So the moment you start talking, after 30 seconds,
they're
the
off.
Insta reel period, that is the attention period. Okay, so more than 30 seconds. Nobody listens to you.
Correct.
Either Insta or your kids.
Correct.
And husbands, anyone never listen to you. So you need to introduce that gently into, do you know anything about periods? Or you can give an example of this person had a period or whatever. Or you can ask about how many girls in your class have had periods. If the child doesn't really want to talk about it, might say, "I have no idea, I don't want to." So she's not really interested. She might say, "Oh, somebody has had." So, are you worried about you didn't get your period? Sometimes that's like body image issues. Oh, there are 10 girls in the class who have got periods and they're looking all sexy, and I'm looking still like a child. So that kind of a thing. You can address those issues. And gently, it should be like almost every day, a very skillfully introduced topic in your day-to-day. And just throw a question, find out what she knows, and give a little information, leave it at that.
Okay.
Don't expect it to happen in one day.
Right.
Maybe over a period of 6 months to 1 year, you're just putting in a few things, and you can send them a few articles to read about,
Or videos and so on. There
or
are so many
videos
things
and
now.
some reels and things like that. They can send this reel.
Yeah, absolutely. How does it happen?
Yeah.
Yes.
So, and also, if some of the parents find it extremely difficult to talk anything about either periods or sex or anything to their children, it all comes with the personality. Those parents, I suggest, send them for a gynecological visit.
Okay, nice.
It's not for a checkup. You can say there is a person who's qualified. The child also feels very objective talking about it, asking any relevant question. And if you can introduce and say, just talk to her, maybe 1 or 2 visits, the gynecologist might be able to give better information than you yourself giving it. So that's one of the options.
And I'm sharing another personal experience here. I met a boy for matrimony, and surprisingly, at those days, I was on periods, and I was having this pain, and I was like, listen, and I was on call with him. I was like, listen, I'm in pain. I'll not talk to you. Oh, what happened, etc. I was like, no, I'm just undergoing my monthly cycles. What monthly cycles? And he's 31, and I was like, and I was in my 20s. I was like, you don't know monthly cycles? And he said, no, I don't know what monthly cycles. Parents think that the education of periods is only limited to girls. Why don't they talk to their boys about it? Is my problem.
Well, the guy probably needed a visit to the gynecologist.
I guess so.
In the first place. I know it's easier said than done, because boys have their own issues of growing up, and 31 is a bit late to be knowing anything about. So he probably is an exception.
Yeah.
But if you're talking about an 18-year-old boy or a 15-year-old boy or a 20-year-old boy, there are a lot of issues about their own hormones and their own puberty and things that we need to talk about, which they're very uncomfortable with. And generally what I have seen is, ideally it should be a man-to-man talk. Okay, dad should be the one who should be telling the boy, okay, this is what happens and this is how you're going to feel. But you will be surprised how many men refuse to talk to their sons. Majority of them don't want to talk.
Of course.
They don't want to communicate these things.
Yes.
And so you're left with a woman, a mother who's talking, and the boys are like, you don't know anything that's happening to me. And that's true. I don't know what's happening in their body.
Yes.
I mean, if you give me a girl, I'll tell her, look, this is what happened to me at this age and this is how I dealt with it. Boy, I have no idea what's happening in his mind or in his body. So I'll be the wrong person to do it. So I think there are a lot of issues actually dealing with the boy with their own problems. So introducing what happens to a girl is probably a bit difficult.
Yeah. I think that the best thing is that, indeed, at a given time, men watching me, fathers watching me, please talk to your sons about it. Mothers, talk to your daughters. Obviously, mothers do at some point in time. Yeah. But I think that we need a more aware audience, especially with the other gender. They just think that it's something so alien and, that's happening to them.
By not talking, it is not that they are not doing their duty or anything. It is that they're letting the children get all the information from sources which may or may not be reliable.
Totally.
So if you want your child to have reliable information, you probably are the best person or a qualified person to give it, rather than getting it from the internet. Yes, internet is useful in easing the person into the information, but to get the right information for the right, customized information for that child, I think you need the parent to be participating in it.
So I think what we can safely conclude is that if at all, the best case scenario is where you can go out and talk to your children about it. As doctor said, introduce it to them in phases, not overnight. And in case you're not able to do this, for whatever cultural issues, restrictions, whatever, our personal beliefs and all, best is to go book an appointment with the doctor and let them be with the doctor, let them have a very safe conversation with them, and then let's see how things go.
And especially things like pregnancy and contraception.
Yes.
These things, the moment the child says, I want to know about contraception, the parent is like, are you having sex now? So at least with the gynecologist, they can get the advice.
Yes. So I guess in our next episode, I'm going to be talking about sex, contraceptions, etc. Thank you so much, doctor. Today's session on periods, teenage checkups, and the issues that can happen with younger girls was extremely insightful. And I look forward to having more such sessions with you. Truly, truly, truly happy to have you here with us.
Thank you very much, Dikshha. It's been a very entertaining and enlightening session.
Sure. Thank you.
Nice. Thank you.
Thank you, everybody. I will see you soon on our next podcast. Remember, this time we're going to talk about something really sensitive. A lot of taboo topics are going to be coming on. Subscribe to the channel for more such healthcare tips and knowledge. And also, if you want to book an appointment with Dr. Usha, the details should be popped in below. Subscribe and call her up, book an appointment. She'd be more than happy to help you out. Thank you.